So having dry eyes is a lot more complicated than just having the occasional dry eye symptom. You may know this as the redness, gritty, or burning sensations on the eyes. But having dry eye syndrome, where your eye becomes chronically or severely dry, that's when the eye can become painful and even cause your vision to be blurry. So in this video, I'm going to break down what causes dry eyes, because there's a lot of confusion out there. And I want to help you understand what dry eye is, and ultimately how you and your doctor can work together to help cure your dry eyes. That's today's video. Let's take a look. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eyes and vision. On this channel we do a lot of educational videos, just like this one, all about eye care topics. And if you're interested in learning more about the eyes, your vision, and seeing your best, then consider hitting the subscribe button down below so that you don't miss any of our future videos. In addition, this video is part of a complete dry eye series, all in an effort to help you better understand what's going on with dry eyes, ultimately the causes of dry eyes, and their different treatments. So if you want to learn more about dry eyes, the treatments that are available, both ones over the counter and in the office through your medical provider, then definitely check out the whole YouTube playlist below. I'll include a link to that in the top of the video description so you can check it out easily. So when it comes to understanding exactly what causes dry eyes, the first thing that we want to review is the contents of the tear film. The easiest way to think of the tear film is in three layers. There's the lipid layer, which helps protect your tears from evaporating. There's the liquid component of the tears called the aqueous layer of the tear, that's mostly water. And then you have the mucus layer of the tear film, which kind of binds the aqueous or liquid component of the tears to the surface of the eye. Now, the aqueous component, I also want to mention, also contains electrolytes or salt, and then it also contains proteins. And that's important because as the salt content changes of the liquid tear film, then that can contribute to a major component of dry eye disease. And we're going to touch on that in just a moment. Now, eye care thinks and categorizes dry eye disease into three main categories. The first category is called aqueous deficient dry eye. That's where you don't produce enough of the liquid aqueous component of your tear film. Then you have an evaporative form of dry eye where the tear film evaporates too quickly. You may still produce enough liquid, but the tears themselves are evaporating faster than you can produce it. And then there is a mixed form right in the middle that's somewhere on the timeline between aqueous and evaporation, but most people, studies show that about 90% of most people who have dry eye disease have some form of the mixed form of dry eye. Now, when it comes to the aqueous deficient dry eye, let's cover some of the main causes for aqueous deficiency. One of the first ones is hormone changes. We know that a lot of people suffer from dry eyes later in lifetime. People can still have it when they're younger, but usually people have it as they get into their 50s and above. A lot of women tend to have dry eyes more than men, and that has to do with testosterone level changes, again, as we age, and that's why oftentimes women will get dry eyes about 20 to 25 years later before men do, before the testosterone starts to change. Next up is sensory block. That's where nerves within the eye are supposed to pick up sensations of dryness and send that signal to your brain and then back to your eye and the lacrimal glands to produce more tears. Unfortunately, for people who've either had trauma or some sort of infection like a virus or potentially other refractive procedures such as LASIK, these different receptors, these nerves, can be severed and they don't function the same way. In fact, they don't even grow back properly. And so you're not getting that feedback mechanism to your brain to produce more tears. That is why a lot of people having LASIK eye surgery can end up with really severe forms of dry eye. Another major cause of aqueous deficiency has to do with medications. If you're somebody who takes a lot of systemic medications for different diseases, these medications oftentimes do dry out the body. Most notably are going to be antihistamines, such as oral antihistamines you take for allergies, as well as any medications for high blood pressure. These medications are most famous for drying out the body. Usually you have to urinate more often, and so you end up with just not having enough liquid in your body to help produce tears. So it's important to remember to drink lots of water. Next up for the aqueous deficient forms of dry eye is that of autoimmune and inflammatory causes. One of the most famous autoimmune conditions that cause this form of dry eye is one called Sjogren's syndrome. I have gone over that more in depth in another video, but in short, Sjogren's syndrome is an autoimmune condition that attacks your parotid glands, your saliva secreting glands here in your cheeks, but it also attacks your lacrimal gland and prevents it from making mucus. The other component are inflammatory causes. This can be things like arthritis, such as rheumatoid arthritis, and this can cause an inflammatory cascade that essentially turns off your lacrimal gland and you don't produce as much tears. This, of course, is not the complete list of everything that causes aqueous deficiency, but these are by far the most common culprits for this condition. Now let's go on to evaporative forms of dry eye, because this is honestly one of the parts that I find most interesting, because this is the type of dry eye I have. And this is really concerning for a lot of eye care professionals, because this is not just causing issues later in life for older individuals like aqueous deficiency, but in fact evaporative forms of dry eye are starting to show up in younger individuals, even people in their younger teen years. Now, when it comes to the evaporative forms of dry eye, there is an environmental component, and we're talking about the humidity, temperature, and airflow. When there's a really low humidity, especially here in the winter time in Minnesota where I live and practice, the furnaces are on, and that usually causes the humidity to be very low, and that tear film is going to evaporate quicker into the air. Temperature in general, if it's hotter outside or indoors, it's going to again cause your tear film to evaporate faster. And then airflow. So if you have air conditioning, a fan, or maybe you're outside, wind's blowing against your eye, your tear film is again going to evaporate quicker, and then you're going to end up with more dryness. Now this next one is really important to listen to, because this affects so many people, even younger individuals who are on things like the computer all day, and that is poor blink rate and poor eyelid closure. When we're sitting just in conversation, we typically blink around 20 times a minute. But as soon as we go onto a near device, we're looking at your phone, a computer screen, a tablet, then your blink rate drops to only about 5 times per minute. And that can be significant, because then your eyes are going to be open and your tear film is going to be evaporating much faster. In addition to just a poor blink rate, oftentimes people don't close their eyes completely. Like myself, I only kind of half blink. I blink enough where my eyelid comes just below my pupil here, so my brain thinks that I've closed my eyes, but in fact, I've left about 1/3 to 1/2 of my entire eyelid open, and that's always exposed to air, so the tear film is constantly evaporating very quickly, and I need to remind myself to close my eyes all the way when I blink. Some people even have eyelid closure issues while they're sleeping, which we call lag ophthalmos, and that means their eyes are open all night long and their eyes are just drying out very quickly. And you may have that experience where you wake up in the morning and your eyes are very gritty and sandy and almost feel like they are stuck together to the eye when you first open your eyelids. Now, what's even more important about understanding how poor blink rate plays a role in dry eyes is the effect on your oil glands within the eye. Now, the oil glands, called the meibomian glands, they live in your eyelids, and every time you blink, these oil glands secrete a little bit of oil. Remember that lipid layer on the tear film that we discussed earlier? That tear lipid layer is going to protect those tears from evaporating. Now, if you're not blinking enough, that means these oil glands, which are activated by the full blink on the eye, then you're not getting enough oil secreted to even protect the tears from evaporating. Furthermore, if you're not blinking enough and you're not blinking completely, if you're not completely blinking like I don't, then these oils can get trapped in the oil glands, and they can sit there, they can solidify into more of a wax instead of an oil, and then they can even go rancid, causing inflammation of the eyelids. And we call that meibomian gland dysfunction, or MGD. And that is a huge component of dry eye disease. In fact, about 80% of all dry eye sufferers have MGD to some extent. And if you ever continue through more of our video series on dry eye, you'll notice a lot of focus on MGD treatments. And then finally, contact lens wear can play a role in dry eye syndrome, namely because it does increase the evaporative component of dry eye because the tear film kind of spreads unevenly on top of those contacts. It can cause sensory changes or adaptation to the surface of the eye, so your brain isn't getting the same sensory feedback loop. You can also have a poor blink rate, and then the contact lenses themselves can not only soak up tears on the surface of the eye, but if they're not fitting properly, they can damage surface cells on the front surface of the eye named goblet cells. And so that can all be contributing factors for this forms of dry eye disease. Now next up, we're going to touch on the inflammatory cycle of dry eye and why the inflammatory cycle makes dry eye syndrome so difficult to treat. But first, let us know how you're liking this video by smashing the like button and then dropping a comment down below about what type of dry eye you think you have. Do you have aqueous deficient, evaporative forms, or a mix of the two? Let us know your story so we can all learn from each other. Now, the reason dry eye syndrome can become so severe and chronic for people is that the inflammatory cycle will kick in. And that's where aqueous deficient, evaporative mixed forms of dry eye, they start to change the salt content of your tear film. Do you remember back at the beginning of the video, I mentioned how the tear film also has salt and proteins in it? Well, what happens if imagine that your evaporation of your tear film, the tear film is evaporating. Well, you're losing the liquid portion of your tears, but the salt content of the tears stayed behind. So if the salt content stays behind, it's going higher and higher in salt, and we call that having a hyperosmolarity. That means the equilibrium of the surface of the eye has shifted away from normal. And that can cause damage to cell membranes on the surface of the eye. In fact, in the eye clinic, we see these as little spots that we call SPK, superficial punctate keratopathy. And in extreme cases, it even looks like someone took sandpaper and scratched the front surface of the eye. After that, every time you blink, because the eye is so dry and irritated, it's almost like you have an open wound that you're scratching every time your eyelid is coming up and down. And that further aggravates the eye, releasing inflammatory proteins, which basically just starts the cycle over again, where the inflammatory proteins can trigger inflammatory causes for aqueous deficiency. They can cause inflammation on the oil glands on the surface of the eyelid, which again cause evaporation, and even the inflammatory proteins can contribute to damage of the ocular surface. And that's exactly why in so many of our videos here on this channel, we're going to cover different treatments for dry eye and why so many of those treatments focus on first controlling the inflammatory cycle along with treating the root causes. So hey, I hope you enjoyed today's video. If you found it helpful, please go ahead and share it with friends, family, or anyone you know who's suffering from dry eye so they can take better control of the dry eye disease. If you want to learn more and check out our full series about dry eye and dry eye treatments, go ahead and click or tap the screen over here to the side, and you can check that out easily. Again, this is Dr. Allen here from Dr. Eye Health. Keep an eye on it, and we'll talk to you soon.